Hello, my name is Dr. Amelia Maskaloff. I'm a chiropractor and founder of Chiro-Health, a chiropractic acupuncture and massage clinic in the financial district of San Francisco. We have been practicing for 16 years in San Francisco, and a lot of our patients come from nearby businesses and most of them are confined all day to sitting at the desk. So one of the things I like to share is and I teach my patients are few very simple self-massage techniques to relieve tension in the neck, in the jaw, in the forearms, wrist, and also a little bit of the palms. These are self-massage tips that can be done daily for 30 to 40 seconds during breaks that you may be taking from typing and sitting at the desk. And they can prevent headaches, they can prevent pain and spasm through your forearms, as well as some carpal tunnel symptoms, stiffness in the fingers. So very useful things that you could do for, as I said, 30-40 seconds on every couple of hours or so. So to start with, we're going to use, for these self-massages, we're going to use the principles of active release technique. This technique utilizes shortening of a certain muscle group, and while the muscle group is shortened or the joint is at a compressed position, applying tension, not pressure, but tension at the attachment points of the muscle. You might think that you don't know where the attachments are, but I assure you, you will know, you will be able to find them. So let's start, for example, with the forearm. So with the forearm, one of the things you could do is with the pads of your fingers, you're going to place your fingers about, a centimeter or two underneath the crease, and you're going to push away and then hold right here. Not going to do anything with your fingers, but holding tension, and the rest of the time you're going to be turning your forearm back and forth. You're going to feel skipping over some of those tendons in the forearm, and there might be a little bit of pain through here or swelling, which you will be able to feel. You can go down and repeat this 2-3 rolls is just perfectly fine. Go down again and just cover this bulk of the forearm where mostly the muscles are. For the wrist, as I said, we're going to extend the wrist like this. Now we're going to put our fingers to grab this part, and from here, while you're holding, you're going to move the wrist down. And you're going to do this again. This is very, very simple, and it feels really amazing. If you do feel any tenderness, that's fine. Just work through it, and you will feel immediate relief. To do the bottom of the wrist, now remember, we need to compress it first. Then we're going to grab with our pads right here, put a little bit of tension, and then extend the wrist like this. So 2-3 times, again, very little pressure, a lot of nice tension. With using the same principles, now we can do the upper cervicals in the neck. So the upper cervicals are these muscles through here, suboccipital muscles. A lot of the nerves that go to the head pass through the foraminers between the first and the second vertebrae and go directly through these suboccipital muscle and into the head, and it could give us headaches. So the same thing's we're gonna do with the upper cervical muscles. We're going to extend our head. We're going to place our thumbs just like this. We're going to push up, and as you're holding tension, you're going to move your head. Now notice that I'm not moving my head from here to here. I'm just extending here and tucking my chin down. So it's a tuck, it's not a flexion. So this is going to feel really, really good. It's going to hurt at the top of the head, but that's part of the release that you know that you're getting. Many of us, while sitting at the desk and concentrating, we actually clench or even grind our teeth without knowing. So we can feel in right from behind the ear If we move forward, we're going to feel the TMJ joint. So we're going to pull the skin of our cheeks up and hold there, and slowly start opening the mouth like this. And again, hold, open. You're going to feel that TMJ open and close under your fingers. During those self-massaging techniques, you're not only massaging, you see that we're not sitting and rubbing knots or anything like that. We're using the function of those joints to help us release the tendons, and that would help probably with tendonitis symptoms, with stiffness, with spasms, with tension, as I said, headaches, some fatigue even, tension through the jaw, also some carpal tunnel symptoms. Do these self-massaging tips maybe for about once or twice or 3 times a day, depending on your stress level and the amount of sitting that you do and looking into the computer. Really very important that you do take breaks. Your eyes also need a break from the screen light. So I hope that you try these, and please let us know how those work for you. Visit us on Facebook, like us, share our videos with your coworkers, and most importantly, if you have any questions or you'd like to visit us at the office, call us at 415-546-1461 or visit us at Chiro-Health SF.com.